Hey, it's Dr. Jinnie Cristerna, the psychological surgeon, and this video focuses on how I work with my patients. Because a lot of people are doing what I admire, which is becoming an educated consumer. So, with that, that means you want to get to know the product or the service that you're buying. You want to know who you're buying it from, blah, blah, blah. Right? So, this is to help people get a better sense of who I am and how I work with my patients. So I'm psychoanalytically and psychodynamically trained and psychospiritually trained. I'm a Rohan doctor, graduate of the University of Chicago, and I have all of my little credentials and accolades. So that you can look up. I think what's the most important thing as a patient when you come into a therapist office, for me, this is my personal belief, is that you feel comfortable with the therapist. That you feel safe enough to talk with the therapist about the things that matter to you, the things that bother you, the things that keep you up at night, the things that you don't want to face. So that safety, I think, needs to be there. I also believe that it's important for you to be with a therapist or with somebody who's going to call you out, who's going to say, hey, come here, let's look at that from this perspective. Or, hey, I noticed that you do this or that you do that as well. Can we talk about that? So I'm not a silent therapist. I'm not a blank screen, although I do believe that there are times when being a blank screen as a therapist is therapeutic and it's helpful for the patient, right? So I work with people who are committed to their treatment, who are committed to themselves. And it can be hard work, right? And there are times when you're going to want to give up, but I'm going to show up, right? So I expect my patients to show up. I'm very clear about where my lane is, what I specialize in, right? My patients know that when they're coming in here, they're not going to be coming in here every week for the next year or for the next 2 years unless they're working through something really substantial and significant. I see my role with my patients as teaching them how to rely on themselves and helping them to remember who they are. Because everything that you're coming in a therapist office to learn, you already know. It's about remembering that. So I take a lot of time and seriousness whenever somebody invites me into that sacred space. I'm very clear about what insurance covers and what insurance will not cover. And if I can help you, I'll let you know that. But if I feel like, look, I'm not the best person for you, and I know you probably got great, recommendations for me from different places, but I don't feel like I can help you, not because I don't want to work with somebody, but because I know that they need something that I'm unable to give them. And I don't think it's fair to rob people of an opportunity to find what they need elsewhere. Okay? With that said, I do psychological surgery. So when you come in here, we're getting down to business, and we're going to basically get you ready to go out into the world, because real therapy isn't in an office. It's out in the world when you're with your family, when you're with your colleagues, when you're in your communities. That's where it matters. That's where you're going to get pop quizzes all of the time. So my job is to help you get ready to be able to do that, and do it being present in your body. Do that without regret. Do that without shame and guilt. Doing that knowing it's going to be a journey, and there's going to be some great and wild adventures regardless of what choice you choose to make. So I hope that was helpful. Let me see, did I cover everything? I'm not a blank screen. I'm upfront about the kind of treatment that I do. Oh, yeah, you need to be committed. And the last thing I would say is that for those of you who are wanting to do surgery, make sure you have the time to do that. They're only 1 to 3 sessions long, yes, but make sure you have the time to do that. Make sure you have the financial resources to be able to finish what you start, because if you don't, you're going to be in a heap of trouble. It's going to hurt an awful lot. This is no different from doing any other medical treatment, except for it's psychological. So, I do tell people to just make sure you're ready to finish what you start, and take personal responsibility when you do and when you don't. Okay, well, I hope that was helpful.